In 2016, we launched the Healthiest Cities and Counties Challenge to help galvanize communities across the country to tackle their unique health issues through innovation and collaboration. 50 cities and counties that responded to the challenge are working with Aetna and our partners to find solutions that work for them. They're focused on addressing social determinants of health, those issues outside the doctor's office that have such a big impact on health, such as community safety and access to fresh fruits and vegetables. Working with communities to develop their own solutions is unique. It's truly exciting work. We hope and expect the challenge will result in stronger communities with lessons to share for countless others across the nation.
Our access to healthy fruits, vegetables, safe, affordable housing, higher level education, all of those things have a greater impact on our overall health status than healthcare. The Aetna Foundation has contributed over $12 million since 2014, investing and awarding communities to actually make these important changes. We have 50 counties and cities involved in the Healthiest Cities and Counties Challenge, and they are all across the U.S. One of our big, I believe, positive outcomes is that we were able to put in, so far, since 2014, 120 urban gardens in food deserts. So 225,000 people now have access to fresh fruits and produce that didn't have access to that previously.
This garden is very important to the future of Tampa Heights.
We definitely feel like what we are doing is good.
We have over 150 gardeners here at the Tampa Heights Community Garden, and we're extending a passion and a joy in gardening to everyone who comes in contact with us in hopes that they will go back to their communities and say, wow, a community garden is a really important thing to do for health and for the strength of the community.
We've put together a little bistro in the youth center. Their families came in one day when we had our big community party, and they served them the food that they grew in this garden, cooked in the kitchen, and then they served them in our bistro, and it was pretty neat. I wish there were more of these in different cities throughout the country.
Communities are taking on hard issues. In New Haven, for example, the rate of pediatric asthma is significant, so they're tackling that.
We have high rates of asthma, particularly for children, and particularly for children who are persons of color and those who are lower socioeconomic status.
I'm 9 years old. I was about 2 when I was diagnosed with asthma.
You tend to have your highest rates of hospitalizations typically in the early fall, around September and October. It makes sense to do a summer camp specifically for children who have asthma, because during that time we're able to give information about health education for asthma, how to use your inhaler.
I learned that last summer. It's not too hard if I just use my inhaler before I do things like run or play tag or hide and go seek. I named it. Its name is Tina.
We recognize that a lot of kids in school are thinking, wow, I'm the only one who has asthma. This way you help normalize that having asthma is okay, and managing, your asthma is even better.
Knowing that people are trying to make asthma better, it makes me happy.